Let's address an operational reality most psychiatry practice owners know but rarely discuss openly. Medical billing is quietly draining revenue from the practice. This happens not because your administrative staff is failing to put in the effort. It happens because outpatient psychiatry has some of the most technically demanding billing requirements in all of healthcare. You have time-based CPT codes that require precise minute thresholds. You have strict rules for add-on codes and modifiers, like modifier 25 for a same-day evaluation and management visit. And on top of that, mental health payer policies regarding prior authorization and medical necessity are constantly shifting. When you place those intricate, specialty-specific requirements on a generalist biller or a cross-trained front desk employee, minor coding errors slip through. Over time, those single mistakes stack up into massive, undetected financial losses. We can see the scale of this problem in the national data. This chart maps the initial claim denial rate across U.S. healthcare, showing a steady climb from 10.2% up to 11.8% in 2024. Psychiatry practices carry even higher exposure to this trend. Mental health claims face intense scrutiny regarding medical necessity documentation, and payers frequently enforce rigid prior authorization requirements for ongoing therapy or specific medications. 100% of denied claims enter the pipeline, but 65% drop straight into a written-off bucket, never reworked. For a practice billing $200,000 a month at standard denial rates, that permanently loses over $140,000 annually. You have to weigh that lost revenue against the high expense of trying to manage this process in-house. A single medical biller, factoring in payroll taxes, benefits, and training, runs a practice between $55,000 and $75,000 a year in fully loaded costs. Then there is the inevitable turnover. When a trained biller leaves for a hospital or a larger group, replacing them costs up to double their annual salary in recruiting and lost productivity, all while your unworked claims pile up. Between the escalating complexity of psychiatric coding and the constant friction of administrative turnover, relying on an in-house billing desk becomes mathematically impossible to sustain. High-performing practices are responding to this friction by stepping away from the in-house staffing model entirely, replacing constant hiring cycles with specialized outsourced teams. Staffingly provides a direct structural fix for this problem. They assign dedicated AAPC and AHIMA credentialed billing specialists to your practice, professionals who are strictly trained on psychiatric CPT codes and mental health payer policies. This highlights the critical operational difference. Instead of running parallel billing software, the Staffingly team works directly inside your existing electronic medical record platform. By logging straight into systems like Epic, Athena, or eClinicalWorks, they eliminate the need for risky data migrations, and you never deal with screen share latency. Integrating a credentialed team directly into the environment where your patient data already lives turns a high-turnover administrative headache into a highly predictable, skilled utility. A practice can fully transition billing operations and go live with this outsourced team in exactly 14 days. During week 1, the onboarding team maps your specific workflow. Within 48 hours, Subsur database connections to your EMR are established and tested. Mandatory HIPAA training and SOC2 Type 2 secure workflows are locked in before anyone touches patient data. Week 2 focuses entirely on staff onboarding. By day 14, operations go live, supported by a built-in, risk-free pilot window. Once live, practice owners maintain total visibility. You receive a weekly KPI dashboard tracking daily throughput, coding accuracy, and measurable return on investment, so you know exactly what is happening. A tightly structured 2-week deployment avoids the months of sluggish training and slow ramp-up times that usually come with a new in-house hire. The human billing specialists are supported by specialized technology. Automated AI tools operate quietly in the background, handling the repetitive processing so the billing team can focus on nuance and accuracy. These tools use smart routing to assign complex payer rules to the most experienced specialists. Meanwhile, continuous background audits scan the documentation, actively catching missing modifiers or coding gaps before a claim ever leaves the system. Here is a chart showing the result of combining specialized human coders with automated audits. We see the towering 11.8% national denial rate on the left, completely dwarfed by Staffingly's operational error rate, which sits consistently below 1%. This scale visualizes the final financial comparison. You have the massive $75,000 annual liability of a single in-house employee sitting on one side, heavily outweighed in efficiency by a fixed, streamlined cost of just $399 a week for an entire dedicated team. Because this structure operates on a month-to-month basis with no long-term contracts, you can scale the billing support up or down exactly as your patient volume dictates. Over 800 medical practices have already looked at their balance sheets, seen the damage caused by unworked denials, and made this exact operational shift. The complexity of psychiatry billing guarantees that minor coding mistakes will happen. The only question is how much earned revenue your practice will leave uncollected before you fix the leak. Book a demo today to stop the bleeding and secure your cash flow.